Hi friends, so we are back with another video and it is in continuation with our previous session which was on radiology for surgeons, and last time we discussed uh, safety and some basics about what radiology is, how it is used, and the science behind it. And now we will start seeing the clinical cases and how to present, how to describe an X-ray, how to read an X-ray. And again, we'll be doing it sections. So today we'll be doing plain X-rays. Then we'll have a video on X-ray with contrast, and then another one with special investigations, which will include CTs and MRIs and mammograms and other special investigations. So let's start. Uh, Last time we did talk about the principles that how it works. So X-ray, we talked that X-ray beam is led to pass through the body of interest, and then some of the radiations are reflected back by some organs like hard organs, and the remaining ones which are able to pass through, they fall on a X-ray film or a digital detector, depends on whether doing an analog or you are doing a digital X-ray. And depending on what, so the amount of radiation which fall on the film depends on the density of material or the type of material or type of the body tissue which falls on the wave. Okay. So if there's a hard, like something like bone is there, which is radio opaque, it will not allow any of the radiation to pass through it. So it will appear totally as white in the ultimate image. So what we have to train ourselves is that whatever is white is hard. So, like for example, when we palpate, I always try to see it in the way we examine things. Okay, so the same way your vision image should be able to create that what is this structure. So if you see something white, means it is hard. It's dense. Okay, whatever we see as black is totally transparent for radiation. So it's like very soft or empty cavities or air, that kind of thing. In between all, I think you'll see various shades of gray. So for example, we are seeing here black tissue, then white tissue, then here is somewhere in between. Like if you make out here, there's a bone uh, which is very white, and then on both sides white, and but in between the two white, the cortex, which is the dense part, you can see maybe not that white, a slightly grayish tissue. So we can imagine that, okay, there is something hard, but it has something soft inside. Okay, obviously here we know bone, but that is how we will figure out that what is the structure. So let's say if I see a circular similar thing which is white on outside and inside there is some lucency as well. But these are the words we'll use. Radiopaque means white, and which is dense tissue. Radiolucent means which is something gray and or black. So it varies in that shade. But in that shade also, we'll be able to say that how thick it is. So if I'm seeing something like this in a rounded cavity, maybe let's say in abdomen or in chest, maybe I can say that, okay, there's something dense walled, but with kind of a semi-solid uh, substance in between. So maybe I can start thinking, okay, what it can be. Maybe it's an abscess, chronic abscess or tubercular abscess. And that is how I'll be able to have some differentials in my mind, seeing that X-ray. Okay. So the art of seeing X-rays is just this, that you train your eyes into not seeing white and black, but immediately your brain should decipher it like, okay, this is hard, this is soft, this is something in between. Okay. Uh, Another thing is we also need a frame of reference whenever we see an X-ray. Okay. So we'll talk about those frame of references as we will see. So this is the basic. I would just want to revise before we go ahead. Now let's start with seeing this. Now, for example, this is an X-ray with in front of us. I don't know what it is. I don't know which part it was done and why it was done. But now I have to describe it for myself, or maybe I'll have to present it in exam, or I have to write the findings or write the report of it, whatever be the task. So it is not like I'll just start saying, okay, this is an X-ray chest showing, which is normal study. Okay. I think it's always good to approach in the same way as we do for examining a patient and then presenting the findings. So it will always start with the identifiers, like who is this person, who is this patient, do we have any relevant history available with us or not? And then in a methodological order, we'll provide the findings of it. You'll always do good if you have some system in narrating the findings, okay? So like in case presentation, we first say that this is such and such person, this is the age, this is where the patient is from, these are the presenting complaints and all that. Now, depending on what all complaints we have, and it's always a good idea. So whatever information is available before seeing the patient, before seeing the X-ray here, is always good to make your differentials. And you'll see your radiology friends always asking for those clinical details, okay? Because it helps. A same X-ray, if it is a young person, it's different. If it's an old person, the reading will be different. If the person has cough, it will be different. If the person has, let's say, mass in breast, it will be different. There's so many things which will differ if we know the clinical details. Okay. So how to go about it is the first thing we describe is the identification. Now you'll say that how do we know seeing X-ray? Most of the time in X-ray, you'll be able to see some identification data. Okay, which is, so I know that this person is this is a cut film, so it's a female 55-year-old. Dayavati is her name, but let's mask the name. But so it's a 55-year-old female, whose X-ray is this, and okay, so this is the first thing we want to, and then maybe sometimes some information will be made available to us. If it is not there, yes, you can't do much about it. But if it is there, it's always should be a part of your presentation. Also, seeing an X-ray, you'll be able to make out a lot of things, that whether it's a male or female, whether it's a old age or young age, depending on the bones, depending on the whether the epiphyses have fused or not. So you'll be able to make out, like in this X-ray, we are not seeing any open epiphyses. So most likely it is well beyond 50s. Humeral head have fused, clavicle head have fused. So these are the things which are seen here. Also, you can see a breast shadow, especially on this side. So that obviously clinches that this patient is a female. So that also you can use this information to say that this is X-ray of a female. Okay. The second things come that what this X-ray is. Okay. And so this X-ray obviously is a chest X-ray. Now, there are various X-rays which we can do, and we should know what X-ray view captures what all. For example, somebody can say that this X-ray was not done for chest, but it was done for shoulders. But I will say, no, both the shoulders are not even included properly. So obviously, the focus here is mainly on the chest, not on anything. So this X-ray is X-ray of chest and upper abdomen, as per the reading. The second thing to describe in the X-ray is whether it's an AP or PA view. Okay, and we discussed that the structure which is later in the path of the radiation appears better in an X-ray. So here we know that if you see the vertebrae are more clear or the heart is more clear, we can very easily see that heart is very clear. And in the upper shadows, you can still see vertebrae clear, but lower part, you're not seeing vertebrae that clearly. So this kind of tells us that it's a PA view. Also, it is written here that that's a PA view, but even if it's not written, we can make out that what view it is. So it's X-ray of chest and upper abdomen, PA view.